Hello, this is MGN podcast in Mental Growth Network, and we are continuing our series of events and series of our free educational materials. And today we have Aline Noizet, and Aline is a digital health expert and mentor for InnoMatch program where she helped to validate a lot of startups. And with her experience today, we want to discuss topic which is called hospital proof and market proof. Hello, Aline.
Hi, Yi.
So today our topic is related to I think, a pain point in a lot of healthcare startups because we as a healthcare startups and as a medical people, we want everything to be science proof and safe. And it costs a lot of money to do that, yes, to really, legally say that you are safe, legally say that your method have positive outcomes on health. And same time, there is this story of financial traction and product market fit. And it looks like you need to test and validate so many things when you're doing a startup. So I decided to invite you to talk about it more deeper, especially in the difference. What is the difference when we do the hospital validation or if we do market validation? So when you hear hospital proof and market proof, what is the first thing comes to your mind?
So for me, it's a bit what you said before. So validation is needed in both cases, but the way you validate is different.
No, then the next question, can you highlight the difference between clinical validation and business validation for the startups?
So for me, when you think about clinical validation, is more a proof that your solution does what it says, or does your solution does what you say it does. So you have to ask yourself, like, does it improve patients' outcomes? You have to prove it. Does it accurately diagnose a condition? Does it improve the workflow of the healthcare professionals inside the hospital of the health center? Is it safe to use? So that's the clinical part. And then for business, it's more like a proof that there's a market for it. So is there a demand? Like, are people gonna buy a solution? Does the business model make sense? Because you have to make money and you want those people to buy the solution, but it should be logical. And is it better than the standard of care? So those are the type of questions that you need to ask yourself, and they vary a bit if it's clinical or business.
And can you give some example? Especially, I'm interested, maybe you got experience with a project who have good medical validation, but as a business, it didn't prove any interest in the market. Do you know anything like that? Any example?
So I want to share an example that's not one of the projects that I supported, but a company that I followed closely for some time. It's a company from the US. It was called Proteus, and it became very, very famous. So the company developed sensors that were embedded in pills together with a patch. So the patient was swallowing the pill, and the patch was actually helping to see where the patient were swallowing the pill and at the time that they were swallowing the pill. So that was really the focus, was for adherence for the patient and follow-up of the different treatment. So that company did a partnership with Otsuka, the pharma company, for the drug called Abilify. So it's an antipsychotic medication, so to treat different mental health conditions. And together, so bundling the drug from Otsuka together with the technological solution from Proteus, they launched Abilify Matsite, which was the first FDA digital pill. So that company actually originally raised some money. So they have like 500 million in total. Out of that was 88 million from Otsuka. But the thing is that the company had a big burn rate. So they were burning about 2 million per month because, as you mentioned before, clinical validation is expensive. And they did that clinical validation. But on the other end, they didn't have enough incomes to compensate that burn rate. So as I said, like, clinical validation was done on their side. It was validated. But the thing is that they needed to raise more money to compensate for that burn rate, and they failed to do that, and they had to shut down the company. So where I think it's very interesting is, like, if you look at the reason why. So it was like a mix of reasons, but for me, one of the most interesting one is actually the fact that the business model was not working properly. So if you look at it, the generic drug, so the Abilify drug developed by Otsuka, it was sold between $500 to $800 per month. But the Abilify Matsite, so the digital pill, the price was $1,600 per month. So the price was actually doubled. And the issue there is that insurers and hospitals were not willing to pay for that. So that's where, back to your question, clinical validation was here, but then the market was not ready because they didn't validate that. So looking at the standard of care, the way that innovation was working, it was doubling the price, and the market was not buying it. And that's why the investors just stopped putting money in that company.
And here then another thing. So it looks like the company created a tool which is necessary, yes, for the patient, because they validated it, have interest, it looks like, wow, amazing technology, but then it died. And as I understand that the business model, the financial model, the mistake was, in your understanding, was not including enough stages to really test this product in the market before going deeply into clinical validation. Correct or not? I understand you.
It's more that, yeah, it was not matching the market. So the cost as what they are, and maybe a solution like that costs more money. So yes, you can have unmet needs. And actually, other companies are doing the same today. So Proteus died and Otsuka bought the assets that were left from that company. But I know other companies, especially in the US, who are working on similar solutions. So yes, there's a need, but you need to make sure that the health economics are here and that those people are going to buy, and that the price is aligned with the demand and the buyer. Yeah.
So here we can say that it's very important from the beginning. It's more like a product management thing, yes, that you should have very clear metrics, which will help you to understand if it is a green light or red light. But I, at the same time, interesting due to my experience in startup world. Yes, I'm working in startups for ages, and I really noticed that the more financial traction and the more financial model is scalable, and you kind of can show that people buy it. It's sometimes the key decision. Of course, not one of them, but one of the key decisions that investors make. And can we imagine situation that, I don't know, we not yet did clinical validation and we produced a product and did some traction and that's it? So maybe you don't need clinical validation sometimes in healthcare products, or you need like how can we switch to the model just like other startups doing, just doing the traction without validating something, or you just can't do it because of legal reasons? Can you tell a bit more, especially imagining that maybe is not a digital health expert listening to us and he never did a startup, for him just to understand the overview of the industry, how it works?
So I think the short answer would be it depends. It depends on the solution, the type of solution. If it's a like hardcore medical device, like cardiology related, where it has to go inside the body, for instance, you need clinical validation. Yes or yes. And that will be necessary. But I can think of cases where it's less relevant, or if you got market traction, that's enough to start and get investment, and then you can get your clinical validation. So I was thinking of two examples. One is a Headspace. So I think Headspace is a meditation app. It became very famous during the pandemic. Not lots of people used it to calm down. And Headspace are one of the leaders in the market today for mental health. And they've been wanting for some time to offer clinically validated and FDA-cleared meditation programs. So they want to become a prescription meditation app. And I think in their case, that could actually work because they really have, like, being the leader in the market today as a consumer solution. They can start with that and then do their clinical validation as they are planning on doing. And the other example for me would be like solution like Aura Ring. So Aura is really also working very, very well. They announced recently that their ROI is very high. Like they're very successful. Lots of people, so consumer people are buying the solution, and it's not cheap. So to buy the ring, it's about over 300 euros for the ring, and then you've got like 6 euros per month as a subscription, but it works. And in March last year, or this year, sorry, they appointed a chief medical officer. So we can think also they're gonna be doing something more related to medical device, because many people think otherwise, but Oura Ring is not a medical device. And if you, in the app, it's very clear. They clearly said it's not medical device, it can't diagnose, but we can imagine that they can move towards being medical device, or part of their features being towards medical device, and having the big traction that they have today can really help them.
Here I have some question for you, also related to this stage of, I don't know, person who is planning his project, yes. And I can also imagine the situation when you can create a drug or you can create a medical solution which people are not enough educated to use. They don't have habit to use this product. And even if there is a need from like the medical perspective, there is not enough need from the customer perspective. So if I have situation like that, I am genius, I don't know, innovator, I understand the thing that will be really interested in 50 years. Should I stop my project? Or should I don't know, do something like, I don't know, include educational program in my financial model or something. Well, what can you give advice if I'm not sure it will have a medical, right now the financial traction, but I want it because I have understanding from the health perspective that it's really a good thing. Like,
Well,
what can
first
you advise the person with this situation?
you need to make sure that there's a demand. You need to validate that somehow. And actually, it's funny because I had that conversation with a startup recently. So what they're doing is very innovative, and it's not yet part of the medical workflow. And they are trying to get into the hospitals. And our discussion was around that. It's like, what do I do to get my solution in front of those people? And it's not something that they will know about because it's new. So my suggestion there for them was really to network a lot, to go to event, to identify KOLs, so people who are influential in that space, in that specialty where you're developing something, get in touch with them and tell them about your solution, because you need to find your allies inside the hospital, inside the medical center or healthcare system, because lots of those projects that are starting inside the hospitals, it comes from them. So they will define some priorities, some projects that they want to work on. And it's easier for you to collaborate with a hospital if you're aligned with one of those projects. But if your solution is so innovative that nobody's working on it, that's where it's difficult. So for me, that's where you really need to like build that network, build relationship, that education that you were talking about now, to really make that, to help them understand that yes, your solution is futuristic or no, but that it will have a big impact. So help them understand how it will make the day-to-day easier, how it will impact the workflow positively, and the impact that it's gonna have on their patients.
Thank you, very good advice. And even, from the project management perspective, yes, it's important to divide big tasks into smaller things. Yes, and same as for testing and same for adoption program. Yes, if you have so much innovative products, start small. Start and include yourself in the existing programs, maybe partnerships, maybe not doing 10 innovative features, but doing one feature first, and then if it's proof itself, and then around it you can little by little, when it's right time, yes, you add more things. Otherwise, you will stuck in this situation, and that's it, and it will not go anywhere. But let's go back to our topic of hospital proof and market proof. So my interest, due to I know you work with Europe and same time you have some experience with US project. How does Europe differ from the US in terms of how hospital proof and market proof are valued?
So there's a big difference between EU and US. It's the regulation. So in EU we follow the MDR, medical device regulation, and in US they follow the FDA. So that's critical. If you're a medical device, you need to have the certification from one of those two institutes, and that's what will help you to enter the different markets. The difference is that MDR in Europe, it's actually granted by private independent notified bodies, while in the US, it's FDA manages that directly. So from that perspective, it's a bit easier in the FDA. And the other thing is that the MDR, as we know it today, came into action, I think it was maybe 4 or 5 years ago, maybe a bit more. And that new medical device regulation actually is a bit more complex than it was before, and they're asking for increased clinical data. So it makes the process a bit longer, a bit more expensive than it was before. So more burden on the startups. And while before startups prefer the EU, now more and more they prefer to go to the FDA first because it's actually faster and easier. And another thing that the startups prefer about the US and complain about the EU and the MDR is that in the US, you can have an appointment, free appointments with FDA officials, and you can discuss your plan. When you apply for FDA, that's what I am planning to do, that's how I'm going to do it, and they can give you feedback. So it's like collaborative approach to get the FDA. And in the EU, you can't do that. You can't talk to anybody from the MDR. So it's a known issue, like the notified bodies, they're aware of that. And we're hoping that things can change at some point because it can really make a difference, like accelerate things. Because otherwise you apply for MDR and say, no, sorry, like you get rejected for reason ABC, while in the FDA you prevent that because you have the conversation before. And maybe the other difference, if we look more at like market proof, like difference between US and EU, is that US is one big market. So that's why startups also prefer the FDA, because you apply for FDA and then you have one big market in front of you. While in the EU, MDR is recognized across Europe, but we still have like 22 countries, and you have to speak to each different countries, and each country has its own healthcare system, each rules, etc. So it makes it complex and time consuming for the startups here. And then maybe also in terms of pricing. So in the EU, it's more like value-based prices, and the government, they use international prices as a reference, and it limits the flexibility of negotiation around prices. Well, in the US, you've got higher flexibility in negotiation, and it's more like market-driven prices. So that can make a difference.
Thank you. Quite interesting. Looks like, yes, it's easier to start in US, but still
I
we
wish it
want to
was not
say,
the case, but
yeah,
because we have
but
like lots of
Mhm.
talent in Europe, and that's what we said. We are losing them to the US, and we would like to keep them here. But for this, I think things need to change in around regulation.
Yes, and one of the idea of mental growth network is that we want also future support regulative processes related to mental health and trying to simplify them and boost our business here. So still, as for regulation in European Union, also just to mention that there is a private consulting companies which you can also apply for to help you to prepare for regulation. Because even if they don't provide the official services, there are some private companies which can help you in that. It's not like you are totally alone, only you and ChatGPT and nobody help. You know, there are some people who go through it,
Exactly.
but you need to pay money. So anyway, it's more expensive. Yes,
Yeah,
this is
yeah.
true. This is true. Okay. Related to our focus on mental health, I'm not sure if it's your direct specialty, but I will be interested if you know anything about that. What are the first things hospitals usually look for when evaluating a new mental health solution?
So I don't know if this is really specific for mental health, but it will be for when you try to talk to a hospital, no? So first, the hospital is going to look if it meets one of their unmet needs. Is there a need for such a solution, or can it bring an answer to an unmet need that they have? And they have many in the hospital, so they also need to prioritize. Then they're going to look if your solution is evidence-based. So has it been clinically validated? Do you have proof that it improved the patient's outcome? Is it safe to use? So those are important questions. They will also look if it's GDPR compliance, like the data aspect is very important. So who owns the data? Are they anonymized? Like depends on the solution. If there's like exchange of data, if they're looking at data, where the data staying. Another important aspect is the integration in the workflow of the hospital. So will it integrate with the hospital EHR, like in the workflow? How does it work with the day-to-day of the healthcare professionals? And how does it compare to the standard of care, like the way they're doing things today? How is your solution gonna impact? How different is it gonna be? And how is it gonna impact the relationship between the patient and the HCP? And then another important point that they're gonna look at, like hospitals are receiving lots of applications all the time, and they are not always technically savvy or digital savvy. And you need to help them to understand what makes your solution different from others. That's very important because maybe for them it's gonna look the same. Say, yep, I've got like 10 companies like you coming to me every week. So what makes you different? How are you gonna help me? So that's also important.
Thank you. And highlighting this like topic more deeper, I know that you've been involved in supporting pilots between hospitals and startups, or what are the key success elements for those collaboration to thrive?
So maybe adding to what I was saying before. So first, like yeah, identify a clear unmet need. Like for me, that's very critical, especially in healthcare. Then you have to validate the practical feasibility of the pilot in the hospital. So you have to understand the technical requirements, stakeholders, mapping, who is going to be involved in the solution, who is doing what are the key responsibilities, who are going to be your champions inside the hospital. Then you need to understand well how the hospital works. That's really critical. Like, what is their workflow? Which EHR are they using? The standard of care that I was mentioning before. Like, all of this should be crystal clear for you. Because if you answer one of their unmet needs, you need to understand it very well so that you can present a solution to them that really align with that unmet needs. And then something very important, it's to define objective and KPIs beforehand. So when you want to do a collaboration with a hospital, you need to define measurable KPIs that will be validated at the end of the pilot. And that will help you to decide if something happens after. So what does success mean for a hospital? And what does it need to happen for the hospital to purchase the solution after the pilot? And that phase is very, very important because it would really help facilitate and you're sure that you're aligned on what the hospital is looking for and what you can offer. And then based on that, you need to define a clear plan with the role of each stakeholder in the institution, so related to the stakeholder mapping and the timeline. And the timeline should be, it helps to get a timeline. So all the project that I'm doing through InnoBuyer, InnoBuyer was 10-month pilot. InnoMatch is going to be 12-month. But because we have those tight timeline, it really helps both the startup and the hospitals to make things happen. And as I was mentioning before, like make it clear what makes you different from the competition. And then the last advice that we've seen a lot, like communicate a lot, like speak regularly to the hospital, like have a meeting, even if it's a short one, once a week, to make sure that you're aligned, like discuss any doubt that you may have. Because at the end, the people you're gonna talk to inside the hospitals are gonna be your champions and you need them. So the better that relation, the better for you and for the project.
You now just said interesting thing that when we plan the project, the KPIs and metrics that we want to use in our experiment or in our solution or in our validation process, whatever, we can also use these metrics as a way to upsell in future this product to the existing program or existing hospital. Is it correct? My understanding. And if yes, can you tell a bit more, maybe some examples on like which type of metrics this can be?
So you need to understand what will motivate a hospital to buy your solution. So oftentimes it's two things, either to decrease the costs, and that's the case for the public institution, or also to gain some money. So that's an argument you can use for private institution. So you need to keep that in mind. Those two are arguments. And then you need to define KPIs that will show that your solution can actually save cost. And those KPIs should be measurable. And at the end, you're going to say, okay, look, like with our solution, you can save like, I don't know, 1 million euros per year. And that's how you're gonna convince the hospital. But first, that should also be very clear what's the argument that will convince the hospital to buy your solution after. And then you match those KPIs based on what they need. If it's to make more money, that's how you prove it. If it's to save costs, that's how you prove it.
Thank you. Next question will be about mental health and the process of challenges that we can brought. If you can think about how do mental health solutions face different challenges in hospitals compared to physical health solutions?
I think first one barrier, and things have improved a lot, things especially since COVID, but mental health, it's not always seen as a priority. And the awareness around it and understanding of mental health, it's still not there. So maybe institutions don't see it as a priority, and they see priority more solutions like oncology or cardiovascular, because those are the leading causes of death in the world today. So hospitals like put their focus on that, and that's where they want to put money and have solutions. So first, there's like this awareness and convincing institution that mental health matters. So that's the first one. And then the other thing, what makes mental health solution different is like the way you measure. So if you take like cardiology solution, it's like hard proof to measure. So you can do a test like a blood test or MRI, a TAC, and you can show that your solution is working on it. With mental health, it's more difficult. Like, how do you measure anxiety? It is a person. So the proofs are more subjective and it's more patient reported. So it's not as easy to measure mental health improvements. It takes longer also to see the side effects. And often mental health is associated with other conditions. So someone who has an oncology condition, for instance, like mental health is associated to that. So you'll put a treatment, but how can you prove that it's the mental health treatment that's helping and the oncology treatment that's helping? So making the difference between those two.
Yes, and you brought an interesting and painful topic because when we talk about mental health, we can also say that this is a very common influence on any health disease, physical one, I mean, such as cardiovascular. It's very easy, yes, you can kind of understand the logic behind it, but when it comes to measurable outcomes, yes, you brought up very interesting question. How to define it's your medicine working or this medicine. And in general,
Exactly.
it's a big question because patients often have several programs that we're doing in the same time. That's why it's so important to collaborate. But not to demotivate our mental health workers, we still need to develop it, but you should understand that it's a science and we need, to be more concrete. We need to have more strong proofs. Otherwise, the situation will not move and it still will be like this is like the main course, and then mental health is something supplementary. Yeah, so to switch it from this to the core one, yes, we need to have enough data from the research that we all do during our projects.
But maybe actually, if I can add something here. So a few years ago, I went to a conference in Portugal about brain health, and it was a very interesting conference. I really liked it. And in the first panel, one speaker said something that stick with me since then. He says that brain health is where cardiovascular was 20 years ago. Means that we are 20 years behind when it comes to mental health. So we like mental health and brain health. We don't know enough yet about the brain. And I think that's also adding to the previous question, why it's so complicated, because there's still knowledge gaps when it comes to brain health, mental health, and science needs to catch up, and we're active in the space.
True. Going to some of the last question. So when we talk about the marketing, as we discussed it, there is this market proof and there is this clinic proof. Can you tell one more from maybe even from the investor point of view or from the co-founder point of view? So what is this one thing startups should always remember about the difference between the adoption proof and the scaling proof? Scaling in a way how business wanted to be in the future, and adoption how this is more deep on what we talk already about the clinical validation. What key things that startup owners should remember about that?
So for me, when it comes to adoption proof, is that there's a need and your solution brings an answer to that need. And that's important. And then for scaling proof, it's like there's demand and your solution is adaptable enough to be used in as many places as possible. And for me, also the scalability should be taken into account like very early on when you start developing your solution. So you validate market fit, but taking into account scalability to be able to scale as fast as possible in as many places as possible. Otherwise, you're going to lose time.
Last question will be about the NGOs and accelerators because we discussed that there is some agents in between this relationship of hospital proof and validation. If you can name some, maybe some NGOs can help you. Maybe some business accelerator doing part of this work. Just any of potential, organization that can be interesting for a startup founder to launch his business in a validated way. Who can support him and how?
So do you mean like NGOs specialize in mental health or in general?
No, maybe NGOs in mental health, maybe business accelerator for, I don't know, any for medtech that helps together with, not only about money, but also about the hospital validation and so on. Anything that comes to your mind, which can just, support a startup founder.
Okay, well, there's several. It really depends, like where you are, which country you're in. Here in Barcelona, for instance, we have an organization called Texam Xarxa or Xarxa Texam, and it's specialized in mental health, and they're really helping mental health entrepreneurs to develop this different aspect, and they're quite early. And then there's an accelerator or an incubator in Berlin called Vision Health Pioneers. And they're helping companies with ideas to go to the next stage to develop an MVP. And so I've been mentoring them for several years, and they have had several like mental health solutions and like all types of solution. I think it's key when you're a young company to approach one of those organizations because it really gonna make a difference. Like they're gonna help you, they're gonna guide you to write the validation of what do you need. Do you need clinical validation or no? They will also offer you a network, put you in touch with the right key opinion leaders, so the right people that can challenge you on your solution and help you take your solution to the next stage and scale up. But yeah, I think we're lucky today in Europe. We have like many different programs that we can approach. And many of those programs are actually equity free. You don't have to pay, or they just offer you the support for a period of time. Others are more like longer term, and then you become part of a community and you're connected with them, like I would say forever.
Thank you so much. Just to tell us about Mental Growth Network, that we also plan to help mental health projects, and we plan soon to launch our hackathons, which will be the 72-hour sprint when you can come and just try to create a prototype. For example, some need of a patient and you want to work it out, or I know you're engineer and you're interested in supporting some healthcare project or any stakeholder related to startups, which whatever can be interested to have a practical experience. And this will lead also to be guided and developing this prototype in future, how to start your own project. So if you are also interested, just to try out something, hackathons can be a good way, as a non-risky way, as a way when you're not responsible for an investment, but same time you can, meet necessary people, maybe more experience than you in this field, and you can get some real feedback. Aline,
And
it was
I
really
think
nice to
it's
talk. Mhm. Please,
sorry if I
please.
can add something. I think hackathons are also very good to find your co-founders and new team members.
Yes, I agree because you have practical experience, and this is what lack of. As the person who did several startups, I can tell that founders is so critical important, and you really don't understand the people until they show themselves in action. So
Exactly.
this is very helpful. Thank you so much for your time. I think it was a good topic that we brought to today. Yes, maybe some of us want to have more information related to, I don't know, the frameworks we should you use from the project. Yes, and for specific country, but I suppose we just help you to, to clarify a bit mind, what can be the next steps, what you should take care from, remembering that both are important, and business and medical, and they should work together. Yes, you are doing the business, but business in the medical, legally controlled field, highly controlled field, yes, which related to safety of people. And for this, you need to know to think broader, and this thinking should be not only on some, ideas how to validate interests, but also in the idea how to make all these stages of validation together, matching the financial plan, the business model, financial model, that you will not burn all your money, and then with all this amazing high tech and spending a lot of things, nothing will go on. And there are plenty of projects like that did this, because it takes time to learn how to do the correct financial modeling to your project. It takes time. But after you will do it, yes, and you have some ideas how to test your visualization, your imagination, yes, and if you can test and it's all correct, and that's it, you're ready. You're ready to speak with hospitals, you're ready to speak with government, with investors, and so on and so on and so on. Thank you so much again for your time, and see you soon. It was our second podcast with Aline. By the way, she was at our first podcast. Now we're little by little growing, and we have more followers and more education materials in our LinkedIn and in our YouTube. Happy to see you more, Aline, and see you. Bye bye.
Thanks for the invitation. Bye bye.